The Lagos State branch of the Nigerian Medical Association members have started a sit-at-home from 6 p.m. today over what the association describes as conflicting directives on the enforcement of curfew in the state. The association says that the confusion has led to the harassment and intimidation of its members and other health workers, including stopping an ambulance conveying a patient from getting to its destination. The Lagos NMA vowed that its members will not go back to work until a written statement is issued by the government as well as the police authorities, stating in clear terms the status of essential workers as the curfew enforcement continues. Nurses have remained firm in their role of providing healthcare even in the face of the COVID-19 pandemic. And that's according to the chairman of the National Association of Nigerian Nurses and Midwives, UBTH branch, Augustine Osigbeme, who believes attention ought to be given to their welfare. He, however, maintains that he and his colleagues have had no negative experience with officials enforcing restrictions meant to curb the spread of COVID-19.
The World Health Organization's State of the World Nursing Report 2020 indicates that the global nursing workforce is 27.9 million. The WHO also recognizing the critical role nurses play in health promotion, disease prevention, delivery of primary, community and emergency settings care, designated 2020 the International Year of the Nurse and the Midwife. In Benin City, Edo State, Nigeria, this nurse, working in one of the COVID-19 isolation centers, captures the role of nurses in healthcare provision during the COVID-19 pandemic, as well as some other issues the situation creates.
There's a report that some persons are running away from patients. It's true, we have seen it. We see it every day. But nurses attend to their patients in the clinic, all the wards. If you work in the hospital alone, you are a suspect, you know. So people stigmatize, but of course we are used to it. If you do not expect to be hit by a bullet, don't go to the war front.
He also touches on how the government's directives aimed at curbing the spread of COVID-19 affects essential workers, especially his colleagues.
In order for us not to meet with the security men on our way home, they broke the shift into two, actually. So morning will close late, afternoon will resume early, night will resume early and close in the morning too. It goes on everybody. People are mindful of getting one time. But for those in this team, some people still leave here late. From those who leave here late, no report of harassment from anybody.
Another point raised is the need for improved welfare package for nurses during this period in recognition of their essential role and strengthening of the nursing workforce. Jessica Lubuse, Channels Television News.
We can now go to our correspondent, Olu Phillips, who is, I believe, standing outside one of the government hospitals in Lagos. Good evening, Olu. What can you tell us about this sit-at-home ordered by the Lagos State Chapter of the Nigerian Medical Association?
Good evening, Laddie. We're standing at the hospital roundabout, one of the state-owned hospitals, Lassus to be precise, is to my left. We can't pan the cameras towards that end because it's completely dark. But here we are in Ikeja. And what we have seen, I took time early enough to go into the hospital to find out what's happening. And I will tell you categorically, Laddie, that that directive by the Nigerian Medical Association Lagos branch is in effect. It has taken effect. And so what that means is that all the doctors that are on call who can't make it before 6 p.m. have currently down stool, and that's the situation with all the medical places that I visited today, especially the government hospitals, Laddie.
What is the reaction of other medical personnel apart from the doctors? Because the NMA, of course, is the umbrella body for doctors. But there are other medical personnel, nurses, radiographers, and so on. What's been their reaction?
It's a head, shoulder, neck, body kind of a system. So I'm not saying anyone is the head here, but the head can function without the neck can function without the head. So if you're a nurse, for instance, you're not someone I would want to consult if I come to the hospital. So this is another dive or another drive into a journey or on a route that we don't want to be. We've been there too long a time, and we've gotten to a point where our medical officers are now being harassed by security officers, and somehow these other medical practitioners are in solidarity with the doctors, and they're hoping that this will soon be over. I spoke to one of the doctors that works with one of the government hospitals on the island, Dr. Washington, and he told me that he will be on call between Friday and Sunday, and if that doesn't happen before 6 p.m., he's just going to sit down at home. I also spoke to the director Clinical Services and Training for LASUT, who is also the chairman of the Medical Advisory Committee for LASUT, and he told me, yes, this is in effect, and doctors are not here, but they have done something. They've pleaded with a few of them to stay at the emergency ward so that if there are any emergencies, that can be attended to. That's the tale of the essential workers here in Lagos, and we are hoping that this is not what the police, especially the IG, wants to achieve.
What has been the reaction of the patients?
First of all, Ladi, look at it this way. Since the COVID era, as it were, one thing we notice about the hospitals are that people are now a bit skeptical to go to the hospital because they've heard things like it's the fastest way to get infected with this thing. So we can't really say that the scarce presence of people we saw today, this evening, when I went into LASUT, could be as a result of doctors not being around. But I'll tell you that when we visited LASUT earlier this evening, the place was almost completely empty. We can't say. But when I spoke to some of the people, patients who were waiting to be attended to, they said this is not what they want to see. They said there's COVID, and now we can't have doctors to treat other ailments that are not COVID. I feel for them, and I hate to say that patients and those who are sick will be the ones to take the fall as far as this quagmire and this push and shove is concerned between the medical association and the security personnel who do not want them to be out after 8 p.m.
Finally, Olu, of course, you yourself are essential service, just like I am and all journalists are. And there are other people who are essential service workers as well, even outside of medical personnel. Did you find it easier to move around? It is curfew time now. Did you find it easier to move around today than you did yesterday when the previous order was in effect? I must emphasize, of course, that that order has since been reversed by the Inspector General of Police.
Laddie, this is it. I didn't want to run foul of the law, as it were, because I would have to have been arrested before I can explain why I am on the road. So what we've done, early enough, we've found ourselves in a position where we can be before 8 p.m. What, however, happens after 8 p.m. as an essential service worker, journalist that I am, is what I can't guarantee, because even, like you mentioned, that directive has been reversed. But how that has cascaded down or distilled down to the last man on the street is yet to be seen, because we still have some little pockets of harassment from some of the security forces who seem to not have heard that we really need to be doing what we are supposed to be doing constitutionally, Laddie.
Thank you very much, Olu Phillips. Do stay safe, and we do hope that you don't experience any harassment on your way back to the studio. Our correspondent, Olu Phillips, there reporting from Ikeja in Lagos. Well, in the studio with me here is the chairman of the National Association of Nigerian Nurses and Midwives, the Lagos chapter, Comrade Blessing Israel. Thank you so much for your time.
Thank you very much, sir.
Between yesterday, well, let me start from yesterday. What was the experience of your members like in the first directive, which was that, look, it doesn't matter what kind of worker you are, 8 o'clock is 8 o'clock, no going anywhere?
Their experience was disheartening, because I watched the video this morning and I felt so bad for the ill treatment given to them by the Nigerian police force. And this ill treatment is not the first one that my members, the nurses, and other essential workers are experiencing. During the total lockdown, several occasions, I and my team have moved from different police stations to release our members that were locked up by police officers. Even their vehicle impounded. during this period. And because we believe that our profession is a noble one, we were able to calm them down, and we encourage them to continue to, give the services, render their services as they've been doing. And I want to say that we can't continue this way. Our nobility cannot be taken for granted any longer. This is disheartening. That yesterday's was a terrible one. When I saw it on the screen, I saw that it was beyond misinformation. Is like the people that are supposed to protect you are the one working against you. At this time, we need, as essential health workers, not only nurses and doctors, even the media, we need to be appreciated at this time. Our work is, we are overwhelmed in this, during this period. And we should be encouraged by the member of the security agencies, most especially the police force. And I want to believe that this will be the last time this incident will occur.
The members of the Nigerian Medical Association, that is the doctors,
yes,
in Lagos have started a sit-at-home.
Yes.
But from what Olu was telling us there is some element of solidarity from other health, or even though formally they haven't declared that they are going to sit at home or join and so on. What's your take on that?
We want to see the reaction. The NMA wants a letter written to counter what was released, the information released. And if this is not done, of course, solidarity support will be gotten from our own side.
So the clarification that was issued overnight, yesterday,
yeah,
and then again this morning from the police is not enough.
I think to me, I think it's enough for my members. And I believe that if it repeats itself after this incident of yesterday, we will not have any choice than to join NMA in this regard.
I must ask you, though, and it may sound like a funny question, but yes, why are nurses important?
Nurses play a major role in healthcare delivery system. Nurses, we are the frontliners. Nurses, we are the backbone of the healthcare system. Our roles are enormous. It cannot be overemphasized. Nurses, as we are talking right now, we are everywhere, fighting this virus. Nurses and midwife, most especially the midwife now. I can say that in Lagos State, during this period, the midwife have delivered COVID-19 women of their babies. Our role cannot be overemphasized. We are there for the patient. We are there 24 hours to ensure that these individuals get the adequate care from us. And in doing this, there are lots of challenges we are really facing. There are many of our members in the line of their duty, they are positive to COVID-19. As I'm talking to you right now, we have over 400 nurses exposed to COVID-19 and 30 presently positive to COVID-19. 2 days ago, I was informed that my nurse in one of the hospitals was positive to COVID-19. 2 of our children positive, and the husband. And this is a kind of posing a psychological and emotional threat to them. And with this, I think the government need to do a lot for the nurses, for the good work we do. And WHO knows the work we do. And because of this, in 2019, nurses was designated 2020, was designated the year of the nurse and midwife for the good work we do in healthcare delivery system. And the association have done so much in ensuring that members, the public, the community are aware of this COVID-19. Not just being aware of it. We are giving enlightenment campaign on daily basis. Like on the 12th of May, which was the birth anniversary of Florence Nightingale, the mother of modern nursing, we went to Ikeja on that bridge there. We gave them information, create awareness, inform them that COVID-19 the COVID-19 is real, and also the preventive measures that must be taken by the people in the community. Social distancing, physical distancing, use of face mask, and breaking the chain of COVID-19. And what is the chain? Once you are able to wash your hands, you maintain physical and environmental hygiene, which is very, very important. You have broken the chain. We are doing this, and we continue to do this until we curtail this disease and ensure that this disease, COVID-19, is eradicated in Nigeria. And at the same time, sir, we also we have a lot of challenges. Our members, a lot of them have volunteered themselves. They are in the isolation center caring for these patients. And many of them have not been given the incentive that's supposed to be given to them. And these members that I'm talking, these nurses and other health workers have left their family for weeks, and they are not being motivated by the government. I think something needs to be done about it. In Lagos State, thank God the governor has given the hazard allowance he promised our members, but the federal have not done anything. The 50% consolidated salaries, the structure for the hazard allowance promise have not been given up till now. Our nurses need to be motivated for the role they play. We are the backbone. Without us, health sector cannot stand. We are not recognized in many areas, and this needs to change.
Thank you so very much, Comrade Blessing Israel. She's the chairman of the National Association of Nigerian Nurses and Midwives in Lagos. Thank you so much for your time. Thank you for coming in. We'll take a break, and when we come back, we'll update you with the figures of COVID-19 in Nigeria as they stand now. Plus, we'll take the view of essential service workers from another perspective. Please stay with us. Thanks for staying tuned. Welcome back to our COVID-19 update. The total confirmed cases of COVID-19 in Nigeria has risen by 226, as announced yesterday by the Nigeria Center for Disease Control, the NCDC. With the new infections in 15 states and the Federal Capital Territory, the country now has 6,401 cases, out of which 1,734 patients have been discharged and 192 deaths recorded. 131 of the new cases are in Lagos, 25 are in Ogun, 15 in Plateau, 11 in Edo, 7 in Kaduna, 6 in Oyo, 5 each in the FCT and Adamawa, 4 each in Jigawa, Ebonyi, and Borno, 3 in Nasarawa, 2 each in Bauchi and Gombe, and 1 each in Enugu and Bayelsa states. A breakdown of the figures by region shows that Lagos in the southwest still has the highest number of cases with 2,755, followed by Kano in the northwest with 842. In the north-central region, the FCT has the third highest tally with 427 cases. Borno still tops the northeast with 227, Edo leads in the south-south with 119, and Enugu in the southeast with 16 cases. We go now to our Abuja studios to take a further look at the role of essential workers in the battle against COVID-19. And joining us is the president of the Nigerian Medical Association, Dr. Francis Faduile. Good evening, Dr. Faduile. Thank you for your time.
Thank you very much. Good evening. It's a pleasure being here.
Now, what happened yesterday concerning the lockdown of everyone on the road after 8 p.m. and the subsequent reversal, which took place subsequently after that, just before midnight. And now the order by the Lagos chapter of your association that unless they received written clarity, they would commence a sit-at-home from 6 p.m. That, in fact, has begun. The police authorities have issued a clarification, both yesterday night and this morning. Isn't that enough?
Well, thank you very much. From the first instance, the question we want to ask is on what authority has the Inspector General of Police has given this blanket lockdown or this blanket restriction on everybody, including the health and essential workers. It is really unfortunate. The Commander-in-Chief of in the country, and through the PTF, the Presidential Technical, the PTF, has given some waiver for the restriction. And the IGP came out without looking at the implication and ordered that everybody should be involved. We wonder, because the first time I heard about it, I thought it couldn't be true. And we thought that everybody knows that even in war, when you see Red Cross, when you see people who are medical people leading within the war section, they find a way to take care of them, to guide against them. Outside this country, doctors and other health workers are well appreciated for their role in containing the COVID-19. It is unfortunate that in Nigeria we are having such directives that is inimical to the well-being of Nigerians. And this is not the first time. When we started, our doctors were beaten. Some of them had heart fractures while they are on their way of duty. Some of them had been arrested. Many of them have been harassed. In fact, at a time, we have some doctors within the Federal Capital Territory that was made to sit on the floor while returning from a call duty work. And I think this is unfortunate. I think members of the security personnel should be able to understand the essential workers and the reason why essential workers are not involved, should not be stopped from being part of those that are following the curfew. And it is really unfortunate. And if the IGP is coming out late in the night and saying that he's now changing it, the first question we want to ask is, where has he got that directive for him to say even essential workers, including doctors and all health workers, are also involved in the curfew? We need clarification. It cannot be swept under the carpet. Every Nigerian deserves to know what has happened. We have ambulances taking sick patients to the hospital. They were arrested. They were denied their health. And I think it calls for concern of every Nigerian, because this is really unfortunate, and it is totally unthinkable that in this time of the year, of the decade, we are having such pronouncement from high-level security officers in the country. I think it is really, really unfair, because we have even a past president of Nigeria Medical Association was stopped while going back to the house. We have doctors who have been working for hours in the different isolation and treatment centers, and they were stopped. They were made to sit down and stay within amongst the milieu of the confusion, and I think this is unfair. And it
so
is
it's
not
safe to say, Dr. Fadule, it's safe to say that you support your Lagos chapter in seeking for clarity, written clarity over this matter.
Something that has happened not once, not twice, but many times, we need to have clarity. It is the minimum that I think the Lagos State doctors and other health workers must ensure to have. If you remember, the same Lagos State, when they started, they were requesting that every doctor or every health worker must bring their shift, their roster for them to allow them to move. And these are things that totally is unbecoming of our health or our security personnel in this country. And I think we need to put a stop on this. So I am fully in support of the Lagos State NMA for the decision and the activities they have done so far.
Now, let me ask you this, and it may, as I asked the nurse here earlier, it may sound like a trite question, but nevertheless, one needs to understand this. Why are doctors so critical to service in the healthcare system? Why are they essential workers? Why must they be allowed complete and unfettered freedom to to operate during lockdowns and curfews?
Well, the answer is so simple. If you stop any other worker from getting to his or her duties post, such worker can still meet the work back and can still complete those work. If you disrupt a doctor from seeing a patient and you do not allow him to take care of that patient at that critical time, there is nothing you can do. We are talking about life, we are talking about sanctity of life, and we cannot take it for granted. And we have, as a matter of policy, as a matter of what we need to do to protect life in everything we do. And that is
yes,
why
but at that point, Dr. Fadule, let me ask
anything.
you, Dr. Fadule, let me ask, at that point that you got to where you talked about the fact that you have the absolute duty and right to save life, this action embarked by the members, backed upon by your members in Lagos, would it not be counterproductive, considering that if they stay at home, there is the possibility that lives would be lost, and equally importantly, a clarification has in fact been issued to indicate that the initial decision possibly was wrong, and that the position now is that, as it was before, essential service workers, including medical personnel, are exempted.
Well, I want to share your fear, but I must tell you that doctors and other health workers are also human beings, and we have to also protect their life and to see to their welfare. So it is in that wise that doctor must also see that he protects himself so that he can treat other patients. That is on the first side. On the second side, it is also positive that we will need to protect more life. But in the case in which when you are going back, you are being harassed, you are being tormented, and at a time, it also happened to me. I was at a police or a military checkpoint for over 2 hours. Despite myself, identifying myself, showing my ID card, the military officers at those places, they pushed me, and it was ridiculous. And despite telling them what I needed to do, we need to stop. And to stop, we need the necessary documentation. It is not good enough for you to wake up, give an order, and in few hours later, decide to give another order. Let us have it in black and white, and let us know that this is what you are committed to do, and this is what you should do. It is not good enough to just give an order, and you just feel that it can just be done like that. Do you know how many people who died yesterday when ambulances were also arrested? And when we have patients that needed to see doctor, we need to make a change, and that is the change that the Nigerian Medical Association, Lagos State, is requesting from the highest leadership of the security officers within that state.
Thank you very much, Dr. Francis Fadule. Dr. Fadule is the president of the national president, that is, of the Nigerian Medical Association. Thank you so much for your time from our Abuja studios.
Thank you very much. It's my pleasure. Please stay safe.
Thank you, and you too. Edo State government is eyeing screening of at least 300,000 persons in the next 2 weeks to meet the set target of screening 10% of its population as part of measures to contain the coronavirus pandemic. The state governor, Mr. Godwin Obaseki, who announced this in Benin, the state capital, says that the successful response to the COVID-19 pandemic being so far is due to thorough research on the virus and manpower development in the health sector.
We were able to pull in resources, medical resources, from our state hospitals, our local government, primary health care centers, the teaching hospitals around here, and private health institutions. Our target, our goal from our plan is to screen 10% of our population. We have 5 million people in Edo, so our goal is to screen 500,000 and to test 10% of that screened population, 5,000. To date, we've screened 200,000, and we want to make a big push in the next 2 weeks to get to our target 300,000, which we are very, very optimistic we will.
We go from Edo State to beyond our shores, to be precise, Bielefeld, in Germany, where we're joined by the president of the Nigerian Medical Association in Germany, Dr. Al-Amin Dairu. He joins us via Skype. Good evening, Dr. Dairu. Thank you for your time.
Hello, good evening. Thank you for having me.
Let's begin by asking you, how does exemption work for those on essential duties in Germany?
Well, I must really say that when the COVID-19 virus started in the beginning, the most important thing the German government did was to protect the vulnerable people. And when I say vulnerable people, I mean the healthcare workers and also all people who are not capable of helping themselves, who are directly vulnerable to the infection. So healthcare workers are protected in the sense that the PPEs, the equipments they need, were immediately supplied. Most of them were given written letters, permissions to take home in case anything happens. Even if they have to come back to the hospital and stopped by the police, they have a pass. So virtually all the hospital, all the health workers who are required to be in the hospital during this pandemic have a pass. So this pass will allow you to drive all the way to the hospital without having any problem from the police.
In Germany, about 178,000, just over 178,000 confirmed cases, but also a very, very high number of recoveries, 156,966 recoveries. What's been the situation like? How have you, as medical personnel, coped with COVID-19 in Germany?
Well, in Germany, I must say the German government was really quick to react. Quick to react in the sense that it started testing the population very quickly, very early. The vulnerable people, especially the old people, have been isolated. Here in Germany, they have nursing homes. They were taken to the nursing homes, and all the other ones who are not able to help themselves are being kept at home. So that means the infection on those who are really vulnerable and who might have severe infection to the extent of death are not given the chance to be exposed. So Germany has a very high number of middle-aged patients with this infection. And these middle-aged patients have high immunity, high immune system, which helps them to recover from this infection very quickly without going into severe cases. So that means the recovery is very high in the case that the patients are all middle-aged patients. We have very few old patients who might not have survived the disease.
What lessons do you think there are in the German experience that Nigeria could take in its own battle? We've got a fraction of the number of cases Germany has had so far. As a consequence of that, of course, we've got a fraction of the recoveries, a fraction of the deaths, a fraction of virtually everything. Yet there are more Nigerians than there are Germans. What are the lessons that we can take from the German experience?
Yeah. Well, I will not compare the German medical system or the German system with the Nigerian system. Yeah. So indirectly, I will not compare a developed country with a developing country. Yeah. The system are different. I must commend the CDC. They're really doing a good job. But most importantly, what the Germans did is they kept testing everyone. They test. Whenever you come to the hospital, with even mild symptoms, you get tested. I'll give you a good example. After the curfew was reduced, we started operating patients. So a patient came to our hospital who was completely asymptomatic. He was not having any symptom, and we were supposed to operate on him. So at the first instance, we got in contact with this patient. We took the history, did the investigations and everything, and we did the COVID test. And this patient came out to be positive. So in this case, because this patient is positive, all the contacts he had to go on quarantine. So one of the things that is missing in our country, in Nigeria, is the discipline. If we say quarantine, most of the colleagues who were in quarantine had to stay at home for 14 days. They don't go out. They don't just go out, oh, I'm alone at home, okay, let me just go out and pass this. No, they stay, they make sure they spend 14 days in quarantine, and then they come out later. So generally, testing of the patient, community awareness. Community awareness is really important. Most of us in Nigeria, they only heard of the disease, but they don't know what it's all about. But it's real, Secondly, the COVID infection or the COVID-19 is not really, I feel the Nigerian government or the NCDC should not really focus on this COVID-19. They should also remember there are other diseases. There's hypertension, there's diabetes, there are people with kidney failures, there are people who are really sick who need to see doctors. Yeah, so the concentration should not be completely based on COVID-19 because the recovery rate is very high. It's very good, but the other diseases which people are suffering from in Nigeria should also be tagged along. They should be allowed to see doctors in time. So all these are things that Germany did. And the German people, their law abidance is when you say stay at home. Most of them stayed at home. I'll tell you to an extent that the German government, immediately after the isolation, when the people were told to quarantine, German people were getting paid. That is small companies.
Indeed, we seem to be having some network issues with Dr. Dahiru's connection there. Dr. Al-Amin Dahiru, the president of the Nigerian Medical Association in Germany, joined us from Bielefeld in that country. South Africa's number of confirmed cases has risen to 18,003, while the death toll now stands at 339. More than 8,000 people have recovered, and government is holding a series of consultative engagements with different interest groups as the country prepares to move from level 4 to level 3 lockdown restrictions. Here's Betty Dibia in Johannesburg with more. Betty?
Thank you, Ladi. As South Africa prepares to move from level 4 to level 3 lockdown, President Cyril Ramaphosa has been holding consultations with various interest groups. Today he held consultations with different political leaders in the country in this regard, probably to ensure that things are done even better or in more acceptable ways to more people than before. Meanwhile, the COVID stats remain worrisome in the country, but the Health Minister, Dr. Zweli Mkhize, says while the mortality rate is still low, the peak of infection is not expected till July or September. And bearing in mind the high COVID stats in the country, the much anticipated announcement by the Basic Education Minister, Angie Motshekga, came last night about the reopening of schools, this time not for everyone, but for grade 7s and grade 12s.
The National Coronavirus Command Council and Cabinet have approved the reopening of schools as of June 1, 2020. We will start with grade 7s and 12. But also, we will also look at small schools and special schools differently, because we may not be able to use the same measurement for all those other sectors. So all learners, educators, and support staff will receive orientation and training at the start of the school reopening, which starts for grade 7s and 12. We are aware that the impact of the virus also, or the lockdown on families and societies in general, has really created unprecedented pressure and anxiety, and therefore we've put plans in place to make sure that we can provide social, mental, psychological, and emotional support.
Expectedly, the debate on whether to open or not reopen schools has marked reactions to that speech by the Basic Education Minister.
I think it's a good idea to delay it. I think children carry germs, and it would be a quick way to spread the virus if they open too soon.
While assurances have been given that health safety measures will be in place by the time teachers resume on the 25th of May and grades 7 and 12 on the 1st of June. Even the minister admits that monitoring anti-COVID precautions at schools will be a huge challenge to government. Meanwhile, the Minister for Higher Education, Dr. Bladen Zimande, is expected on Thursday to give his own plans for those in the tertiary level of education. So in the next few days, we will be hearing more on what to do about the 2020 academic year in South Africa. Back to you, Ladi.
Thank you very much, Betty. The World Health Organization says it is concerned about the rising number of new coronavirus cases in poor countries, just as many rich nations emerge from lockdown. During a news conference in Geneva, Switzerland today, the Director General of the Global Health Body, Dr. Tedros Ghebreyesus, says 106,000 new cases of infections of the novel virus had been recorded in the past 24 hours, the most in a single day since the outbreak began, as the total number of cases worldwide is approaching 5 million. He says 2/3 of the number were from just 4 countries. This comes as Brazil records more than 1,000 deaths in a single day for the first time in a long time, amidst warnings that the outbreak is weeks away from its peak in the country.
Brazil has recorded its highest daily rise in infections and deaths since the coronavirus outbreak began in the country. Health officials reported a further 17,408 cases and 1,179 deaths in the past 24 hours. Peru's daily infection rate for coronavirus hit a record 4,550 cases as the South American nation edges near a total of 100,000 COVID-19 patients. Peru has been one of Latin America's worst-hit countries in the pandemic. Despite implementing tough lockdown measures, Lima has struggled to flatten the curve of new infections. South Korea reported 32 new cases on Wednesday, taking the national tally to 11,110, with 263 deaths, as schools opened for the first time this year. Prime Minister Chung Shin-kyun urged officials to block risk factors from reaching the campuses as high school seniors began returning to classes. However, more than 60 high schools have ordered students to go home immediately after 2 students were tested positive. And residents of Bolivia's Cochabamba are demanding an end to the country's coronavirus lockdown, saying quarantine has left them without food and money. Bolivia is amongst Latin America's poorest nations, with many families relying on day-to-day informal work to make ends meet. But with restrictions on movement, these residents say they have been left destitute by quarantine and want to return to work.
And that's our package on our COVID-19 update. But before we go, do remember that for details of the figures and the stats, please go to the World Health Organization website. There you'll find all of the information you need, plus tips on what to do if you find someone who is showing symptoms of the COVID-19. ChannelsTV.com also has details of all the breaking stories relating to COVID-19, both from within Nigeria and outside. Please check it out to see if you've missed anything. My name is Ladi Akiridoluale. Do join us tomorrow when we start our updates at noon, and there'll be updates as well at 6 and then at 9 p.m. Good night.